What's the big deal about pelvic floor issues? A lot of people leak a little when they sneeze or have a small bladder, right? Let's bust this myth and explore why common does not mean normal on today's episode of Taking the Floor.
Just kind of reaffirm like, hey, this is normal. This happens to a lot of people.
And for so many of us, women, we just kind of live with it because that's what we're taught to expect. So that's what I did for years.
Welcome to Taking the Floor, the podcast from Hinge Health about pelvic health, movement, and taking charge of your well-being. I'm Bijal Toprani, a pelvic health physical therapist. You'll see me in lots of places around the Hinge Health app, demonstrating exercise therapy movements. And I also work closely with our business teams to get our program into the hands of more people like you.
And I'm Kandis, Daroski. I'm also a pelvic health physical therapist, and I work closely with the team at Hinge Health that creates our app. I help make sure our exercise therapy, education, and other offerings are effective, easy to use, and clinically sound.
Today, we're talking about why common does not mean normal. People have gotten a lot more open about sharing their experiences with pelvic floor dysfunction in recent years. From comedians to movie stars to neighborhood friends or work colleagues, it seems like we're all getting a little bit more open about discussing this problem. On one hand, we think this is awesome. If more people talk about it, more people might be comfortable actually seeking treatment. But a funny thing can happen when lots of people talk about a problem. It can start to feel like it's no big deal. After all, if it seems like everyone has a little bit of an incontinence issue, it must be normal. Is it even worth worrying about?
Honestly, this is a huge reason why we're doing this podcast in the first place. We want to raise awareness for how pelvic floor disorders affect people, and yes, reduce the stigma around talking about them. But we also want to show that these conditions are treatable with the right care, and they are so worth doing something about. For those listening, what are we even talking about? Like, this is like the peasing, right? This is the peeing when you sneeze, the leaking when you laugh, jump, lift up something heavy, having to go to the restroom all of the time, things like pelvic pain or painful sex. Okay, and then there's the poop issues. So I'm talking about things like fecal incontinence and constipation. And these are the ones that people are probably way less likely to want to talk about, but they are still so very common. And oftentimes people do not always associate these with being a muscle problem or a problem with the pelvic floor. So let's explore just how common these issues are, just how big of an impact they can have on a person's life, and most importantly, what happens when somebody decides to do something about it.
Let's get into some stats. We're going to talk about some research that was specifically conducted on women, but just a quick note that anyone with a pelvic floor, which is everyone, can have a pelvic floor disorder. Nearly 1 in 4 women has a pelvic floor disorder.
Yeah, honestly, I would argue that this is actually an underestimate of that statistic, simply due to the fact that people don't always talk about these symptoms, and really research involving women or even around the pelvic floor has really lacked historically. And so we're starting to see that improve, but I would estimate that number is even higher.
Yeah, I think you're probably right. We talk a lot about stigma and embarrassment, and that probably has some cascading effects to people not really reporting that they're even having these issues. Let's go to the next one. So up to half of women report some amount of urine leakage. Also, more than a third, about 35% of postpartum women and about 7.5% of women overall say that sex is painful.
This one is, I think, always really interesting for me to read. It's so shocking because as PTs, we really see sex as an activity of life, just like walking or running or any other normal thing that you would do during the day.
Yeah, I totally agree. Like with other providers, like if you go to your primary care physician or you go to another type of provider, they have certain metrics that they're kind of making sure are improving, right? Your blood pressure's decreasing, your cholesterol's decreasing. For us, we look at exactly what Kandis just mentioned activities of daily living. We want to make sure that those activities of daily living are improving, and sex is one of those. And so it's good to kind of reframe it in that mindset. And it really can help you realize that it's not something you have to be embarrassed about actually seeking help for. It's just an activity in life that you deserve to be able to do pain-free. The next one is also pretty surprising. Up to 15% of women are affected by chronic pelvic pain.
So sometimes that looks like things like tailbone pain, or sometimes that can just be this really icky kind of like diffuse lower abdominal pain that's really hard to explain. So I think it's just really, for me, anything that somebody comes in and describes to me as having this huge impact on their life, but also has been going on for a while.
The next one is that nearly half of women have pelvic organs that have shifted from their normal position and are putting pressure on the pelvic floor structures. This is known as pelvic organ prolapse.
Yeah, and that's a big one that like can commonly increase, after you've given birth, in that kind of like postpartum stage. It can also increase in prevalence with age, but really want to call out that all of these problems we've been talking about so far, they can happen at any point in life, right? So it can happen during young adulthood, pregnancy, postpartum, during menopause, and really beyond. And so when we talk about these issues being big problems, they can be big problems for anyone. So think of any other really common issue like diabetes, let's say. I don't think anyone thinks of diabetes as being normal, but the difference is that there are some pretty well-known treatments to prevent diabetes, improve it, or even manage that condition. But many don't know that pelvic floor physical therapy can treat these common but not so normal issues. And in a lot of situations, it's actually relatively easy to get relief if you have the right tools. Throughout this podcast, you'll be hearing straight from some of our Hinge Health members. That's also the voices you heard at the very beginning of this episode. So let's hear from one of our members now about this idea of minimizing or laughing off your symptoms. Her name is Megan, and we'll be getting more of her story throughout this episode.
But within my social groups, there wasn't a stigma, but it was a joke. It's something you laugh about. And you just accept it, that this is part of your life. It's not going to go away because you've had children or you're getting older or, XYZ reason. This is just part of your life now. So laugh about it and move on. And it's definitely the subject of many jokes.
I think that this is so common. I mean, we hear this from so many people that they're just kind of laughing their symptoms off. And, we do see people do that even with their most trusted friends and family, people that they feel really comfortable with. And it's often because I think that they're just trying to find a way to cope with the situation, right? And I don't think that that's something they're intentionally trying to do. I think it's just something that our body naturally does to just feel like we can kind of move forward and move on. So we sort of laugh it off and we try to cope that way. And what we really hope that we can do is shed some light on the fact that there are things that you can do to kind of move forward, even if you are sort of laughing it off a little bit.
Yeah, absolutely. And I think that it not only helps, the laughter part not only helps with coping with it, but it also kind of helps you talk about it. It's like the way to be like, haha, I this is an important thing to me, so I'm going to bring it up in a joke fashion versus like in a more serious tone. So I think it kind of really, it serves a couple of purposes. But again, all jokes aside, we really do want to emphasize how much these things can really be treatable.
I think there's also just the fact that just saying the words pee and poop sometimes can feel funny or silly. We've just all kind of been raised up to believe those are kind of private things that we maybe shouldn't talk about. And so it feels a little silly sometimes to talk about them. But rest assured, for Bijal and I, it's nothing silly at all.
Next, let's talk about how no big deal symptoms are actually a huge deal. Here's why. They can be stealthy. They often start in the no big deal range and then gradually have a bigger and bigger impact on your life. When the impact gets bigger, you start to limit what you do on a day-to-day basis. Have you ever not gone on a hike, taken a flight, attended a show or a concert because you were afraid you wouldn't have access to a bathroom? What about stopped running or ducked out of a boot camp or HIIT class at the gym because of leaks or pain? Or what about stopped having sex or had sex less often because it hurt or you were afraid you'd leak? Not to mention giving up jumping on a trampoline or playing with or lifting up your kids because of what's going on down there. Here's how this took a toll on another member we talked to, Susan.
I felt like my body wasn't working for me anymore. It made me feel like I was aging faster and that I couldn't perform or participate in things I used to be able to. So it really felt like a decline, kind of a decline in my health, and definitely affected my self-esteem a little bit too. And even, I think it affected my image, but it also affected my ability to pursue things where I might have been able to deepen friendships. Like I remember one time being really excited. I had moved to California about maybe 5.5 years ago, and it's hard to make friends as an adult, I think. And I had arranged to go for a run with a friend from my book club. I thought, oh, this could be something that we could do together and get to know each other better. And I ran to meet her to start the run at her house, which was not far, maybe less than a mile away. And I already had saturated my pants, and I was completely uncomfortable. I didn't have anything, to catch extra urine, and so we didn't run again. It was the only time.
Something that really pops out to me here is kind of this idea or this need to be able to just show up as your full self in order to really have relationships that are cultivated and meaningful, and how distracting it can be. She's worrying about her pants being, saturated, as she said. And it really probably didn't allow her to really connect with this person that she was just trying to create a relationship with. And there's just a lot of that kind of mental load around it. And also the fact that, it's not something that everyone else can see. So it's almost just like we talk about mental health, but that mental health aspect of it, it's if you're sad or you're dealing with anxiety, it's something that's really invisible to the outside world, but it has these huge impacts on friendship and engaging in physical activity and all of those things.
And the first thing that she said in this little snippet really spoke to me, which was, I felt like my body wasn't working for me anymore. Think about how that must feel. And something that I always feel really passionately about as a physical therapist is that connection between your mind and your body. And, your body hears everything that your mind says. And if you are already in this place where you're really feeling kind of down around a lot of these different things and you're feeling limited, and now your brain is starting to tell you that your body isn't working for itself anymore, the implications of that are huge. Finally, let's talk about what you can do about it. Let's just make sure that we're all on the same page here. And so we'll just hop in and do a quick anatomy lesson about what the pelvic floor is and a brief overview of what pelvic floor physical therapy might look like. And then we're going to get back to our members and hear a little more about what happened when they took charge of their well-being and took action on their pelvic floor issues.
All right. So what's the pelvic floor? That's the big question. Your pelvic floor is made up of layers of muscles, ligaments, and connective tissue that stretch from your pubic bone in the front of your body to your tailbone in the back. Together, these structures make up the bottom or the floor of your bowl-shaped pelvis, regardless of your sex. So your pelvic floor is basically a set of muscles similar to the ones in your arms and your legs. It provides support to your organs, sphincter control, stabilization, sexual function, and lots of other things. We'll get into more details on these in future episodes.
Pelvic floor disorders include anything that impacts that normal function of the pelvic floor muscles. So this can involve weakness, tightness, a lack of coordination with other muscles, pain, and they can even happen because of things like increased stress. These issues can crop up during or after pregnancy or menopause, although you don't have to have been pregnant or gone through menopause to experience them. You'll hear more about these symptoms and how they're managed in some of our future episodes.
Next, we want to stress that your pelvic PT has heard it all and is very much there for you. Video visits and other interactions with your care team are comfortable, safe spaces where you can get real about what's going on.
We have to make people feel they're in a safe and comfortable environment so that we can hear the things that they are experiencing and then therefore recommend the most effective treatments.
Yeah, I always like to open up my sessions or any interaction about these things. And I always joke about how like TMI is like out the window. Like we can just throw it out because I just want people to know that it is a really safe space no matter what they're dealing with. They can share it. They can be open with us. Again, we've heard it all. So it's not going to surprise us or turn us off or make us feel less of whoever we're listening to. We just want to get as much information and create a really safe environment so we can really help people with their symptoms.
Yeah, and I think pace is a great word to use here too, because one of the things that I've learned as a pelvic health PT is that everyone is going to kind of go at their own pace in terms of feeling comfortable about sharing information, and that's totally fine. Like we're not in a rush. I've often started sessions with that sentence. I want you to know that we are not in a rush. What we get to today is what we get to today. And I'm still going to be here to talk to you about this issue, in a session or 2 sessions from now. So that tends to sometimes you see people's just like relaxation come over their body. And then I've also been known to just like, whatever you need, friend, like if we need to dance it out right now, because you just need to feel like we are closer friends, I will do that. I will tell you a knock knock joke. I will, whatever it is that you need. I'm happy to do that. And I think most pelvic health PTs would be willing to do that as well.
Yeah, I mean, you just saying we're not in a rush even right now calmed me down. So I feel like that's a very effective method for those visits and just life. So let's remember that.
So yes, there are a lot of different types of pelvic floor dysfunction and lots of different pelvic floor symptoms. But what they have in common is that they are treatable. Working with your physical therapist and health coach to really pinpoint what's going on within your body and learning more about the pelvic floor so that you can maybe also adjust and make some certain lifestyle changes if you need. And then engaging in that exercise therapy and breath work are all things that can make a really huge impact on these types of symptoms.
All right, let's talk about some stats to back this up. Many studies show that a specialized physical therapy exercise program, like your Hinge Health exercises and lifestyle modifications, can significantly improve pelvic floor symptoms, including pelvic pain, leaking urine, and other symptoms. The results for our pelvic health program show a 67% reduction in pelvic pain after 12 weeks, 54% reduction in non-pain related pelvic symptoms by week 12, a 52% reduction in urinary symptoms by week 8, and mental health improvement. So we're seeing less anxiety and depression at week 12 as well.
Bijal, you always have the best stats to really contextualize things. I think these are incredible. I mean, think about all of the things that we've heard so far from our members today and just how much it was really impacting their lives, and thinking about, what if they had a 54% reduction in their urinary leakage and what that would really mean in a person's life. Stats are nice to contextualize, but what does that really mean for somebody? It means that they're running more, that they're playing more with their kids, that they're showing up to work and feeling like their authentic self and not having this like worry in the back of their head. And, as pelvic floor physical therapists, like we are not mental health experts. We know that. But we do see this huge improvement in people's mental health when they're getting a solution or a treatment for this huge problem in their life. And I think it's really just like attributed to the fact that they feel like they have a plan, right? That they know that this is a treatable condition. They now have a plan. They now have a support team that can help them really chip away at that plan step by step. And prior to maybe getting some of that support, they thought that this was something they were going to have to live with. And something that I feel so passionately about is really how taking action against this pelvic floor, these kind of like common, not so common issues today in your life really affects the future of those around you. Because when we don't accept symptoms as normal today and now, then, your sisters, your daughters, your friends, your spouse, they will not ever consider those symptoms to be normal either. And imagine that world. That often is what like gets me at my desk in the morning, is like knowing and thinking that, my daughter is never going to think that it's normal to have urinary leakage. And she's always going to know that there is something that she can do about it and that there are people that want to help her. And so it won't be a common, normal issue for her. It will just be an issue that she knows that she can develop a plan to tackle.
Yeah, that like makes me want to cry because it's really powerful to know that, what we're trying to do now, what we're trying to make more normal in a conversation right now is going to have an impact on people in the future. And this is part of why we called this podcast Taking the Floor. We want to give people the floor to talk about their own experiences. We could go on and on about the benefits of taking care of your pelvic health and why that's a non-negotiable. But when we interviewed some of our members for this podcast, hearing how they improved and relieved their symptoms was incredibly powerful for us. Whether you, listeners, have been part of Hinge Health for a few days or weeks or months, we hope these make you feel inspired and motivated to keep going. Let's hear a few of those now.
So I went from being able to really not run much at all to running 5 miles if I want. I mean, I went from, wearing reinforced underwear or some kind of a pad to, I can wear no underwear. So it's great.
I love this like celebration on going commando. I'm like, that's really exciting. And let's return to Megan to close this out.
It's not a joke. It's not something you have to live with. You can overcome this. It might take a little bit of work on your part, right? You might have to challenge yourself a little bit, but you can absolutely get there. And you should.
Chili willies. I can always tell when somebody has reached the point in their therapy progression where I know that they're going to be good. Like, even if they're not 100% symptom free. And it's this exact point that Megan has reached, where they sort of turn from like this patient or person that doesn't have a ton of context around why this symptom is happening to like a pelvic PT, advocate. And they're out there and they'll often come in and tell you, I told this person and I really think they need to start taking care of this problem. And it's when they become sort of a champion for this type of change that I know my job is done. They probably have some more work to do, and that's okay. We can always all be working, but it's such a heartwarming feeling as a therapist to hear those words.
I agree. There's so much like conviction in her voice. Like you can tell that there's been a flip of a switch and she's just like kind of ready to dive into the world and help other women, which is another big thing that we are really passionate about. let's go over the 3 most important things to remember from this episode. Pelvic symptoms are common, but that doesn't mean they're normal or something you just have to live with.
Pelvic floor issues can have a huge impact on your quality of life, keep you from enjoying hobbies, social activities, travel, impact your work, and your relationships.
Finally, pelvic floor problems can be treated. You can see improvement if you work with a physical therapist, try exercises and breath work, and make pretty simple lifestyle changes.
So, Bijal, I know something that I always really admire about you is your ability to just really advocate for women and more specifically for pelvic floor care. And you said something recently about pelvic floor health not being considered this self-care item or this luxury, that we should actually really think of it as a non-negotiable. And that really, I think, is how we view it here at Hinge Health, that taking care of your pelvic health, really being proactive and trying to reduce your symptoms is a non-negotiable, just like any other aspect of health that we'd want to take care of. So let's just do a quick check-in and see how we ourselves are taking care of our health this week.
My non-negotiable for this week, or at least the next couple of days, is trying to make sure that I am sleeping at the same time-ish every night. So I'm going to try to go to bed at around 10:30 every night so that I can try to get a little bit more regulated and routine with that. What's yours?
So mine is interesting. I actually am like a big nerd, if that isn't obvious enough to everyone listening. But I recently read this thing that your brain, so like going into the neurology of it all, your brain cannot be simultaneously grateful and stressed. So it's impossible to be both stressed and grateful at the exact same moment in time. And so my non-negotiable this week is I feel like I'm kind of going through like some different stresses in life. I'm going to really like buckle down on the gratitude journaling. Because I think it's so easy for us to really debrief on like what wasn't going great that day or like what's not happening for you in life. But when you sit down and like really put pen to paper, you can often find lots of things that are going good. So I'm really going to focus on the good. And yeah, that's something that I want to really practice this week.
This is such a good tip. I'm going to try that as I go through the week. If I feel a moment of stress, I'm going to try to override it with a gratitude moment. It really is so powerful. So thank you for sharing that. And thank you all so much for listening. If you have questions or topics you'd like us to explore in this podcast, or you're interested in sharing your own story with us, feel free to send us an email at pelvichealth@hingehealth.com. Remember, if you're dealing with pelvic floor issues, you're not alone, and we're here for you. The information contained in this podcast is intended to be used for educational purposes only and does not constitute medical advice or treatment for any specific condition. Please consult with your healthcare provider with any questions you may have about your medical condition or treatment. Check out our Hinge Health app library for new episodes coming soon.